Now, new for you this morning, a hospital joining the effort to curb gun violence in Atlanta. On any given night, gunshot victims are taken to Grady.
Liza Lucas shows us why the Level 1 Trauma Hospital is taking on gun violence as a public health problem and how they're trying to address the root of the issue.
I'm a Georgia native. I was born in Grady.
Chitara Alexander's background is not in medicine, but for the past year, she's worked at Grady, the Level 1 Trauma Hospital in downtown Atlanta.
We are not doctors and we're not nurses, but we have the same level of understanding, so we're able to help.
Chitara serving patients through a different type of healing, part of a team intent on interrupting a cycle of violence.
We understand that violence doesn't just happen in isolation, right? We're looking at all social determinants of health.
Dr. Randy Smith leads Grady's hospital-based violence intervention program. The program aims to reach teens and young adults at Grady injured by gun violence, knowing those victims can be at an increased risk for re-injury and sometimes prone to retaliation. The approach is three parts: a bedside clinic community model, relying on messengers like Chi to offer patients resources and support. And for her, the role especially personal.
Being that I lost one of my siblings here and I saw the work that they did to try to save them, I figured if I could come back myself and be able to give that kind of service back to my community, then I would.
And it's that community partnership which is also key.
Hospitals, communities, schools, courts, it's an ecosystem. We have to work together.
Leonard Dungy leads Hope Hustlers, part of the effort to support patients beyond Grady's walls. Data showing 2/3 of those in the program are dealing with food, housing, and financial instability. The goal is to support these basic needs and show youth another path forward. And 1 year later,
It's working.
Grady reports only 1% of program participants have been re-injured by gun violence in the last year. For Dr. Smith and her team, the goal is to continue growing, saving lives in more ways than one.
It's more than just preventing re-injury, it's giving people hope.
In Atlanta, Liza Lucas, 11 Alive News.
Dr. Smith says she hopes to expand the program beyond gunshot victims and be a source really across the whole region. Some injured teens who went through the program are coming back and asking organizers how they can help now.